Like we got 20 people on, so that's a good start. All right, I'm going to go ahead and start letting people in, okay?
Okay. Welcome to everyone who's joining us. We'll get started with the webinar in just a few minutes. While we're waiting, if you would tell us type into the chat box your name and where you're from, and maybe one thing that brings you joy. And we'll just share some chat along the way while we're gearing up for our program. Hi, Jody. Welcome from Indiana. Thanks, Edna. Who else? Where are folks from and what brings you joy? Go ahead and type that into the chat box. Hi, Bill from Ohio and Baroque music. Oh, love it. Beverly, my grandchildren in Texas. Thank you. Bill, spending time with my wife and children. Oh, that's sweet. Sabrina's in San Jose and her family. Hi, Amanda, welcome. Michael in Oklahoma, welcome. My goats, Jody says. How cool. Do you do goat yoga? I've seen videos of goat yoga.
No, they would not do goat yoga.
I'm a yoga teacher also, and I'm always thinking like, really? It seems weird. Melissa from California, my dog brings me joy. Love my two puppies. Michael's from Georgia. Okay. Hearing other people laugh. Yeah, that's fun, isn't it? Nikki in Indiana. And my niece loves goat yoga. Love it. Joining from Florida. Hi, Wendy. My daughter's sense of humor. I love all these. I love all these things that bring people joy. Give it a couple more minutes. Uh-oh, is that a video of goat yoga? I'll have to watch that in a little bit.
No, it's my goats that are on their swing.
They have swings.
Yes.
Okay, so swings bring goats joy. Who knew?
Yeah. They just sit on their swings and they just swing back and forth and sleep.
I love it. I can't wait to watch it. So you download that? There you go. I could download it to my desktop. Cool. All right, Jody, I'm going to watch that later. The outdoors, great outdoors brings me joy. Janice, Springfield, Missouri? Never been there. Okay, maybe let's give it another 2 minutes, and we have over 150 people registered, I think, so it takes a little bit to get them on sometimes.
We will ask everyone to mute your phone line just to make sure.
Who else have we got here? Yeah, who else have we got on here? Tell us your name, where you're from, and one thing that brings you joy. I love the outdoors too. I'm in upstate New York and it's sunny and warm today. It's like, oh yes, we're getting there.
And Lisa, can you admit people from the
I
waiting
can.
room too?
Yep, I can.
Okay. I
Christina
thought when I
from
get started, maybe you
Texas.
can.
Okay. Hearing the ice fall in the ice maker. Well, that's kind of a fun sound, isn't it? A happy sound. In Virginia, a beautiful day at the lake. Welcome, Janice. Melissa in Minneapolis. The sun gives me joy. Yeah. I hear the ice is starting to break up in Minnesota. My mother-in-law lives on a lake on Lake Minnetonka. She says the ice is starting to break up.
All right, Lisa, we've got 40 people on. Do you want to get started or what do you think?
Yeah, why don't we get started?
Okay.
Edna says hiking. Yeah, okay, well, thank you. And if you're just joining us and you want to put your name and your one thing that brings you joy into the chat box, we'd love to get to know you.
All right, I guess I'll go ahead and get us started. So we do have some folks joining us. So Lisa, if you just pay attention to the waiting room and we'll get going, guys. So hello, everybody. My name is Dawn Wilson, and I'm the director of our National Training Institute here at C.A.S.E, the Center for Adoption Support and Education. We're located in Burtonsville, Maryland, and we're presenting with me today is my colleague Maynard, our training and implementation specialist, along with Bonnie Goodwin, who is one of our excellent champions from Oklahoma. So more about her in a few minutes. Today's webinar is entitled Integrating NTI into Child Welfare and Mental Health Practice, Supervision and Coaching Approaches for Knowledge Application and Skill Transfer. So I know we asked you when you joined to let us know where you're joining from, and I think you could just keep doing that as you come on. We do love to know where folks are joining us from. We know we have folks from all across the country, and I see Melanie from Washington. So hello, Melanie. Nice to see old friends. Okay, so do you want to advance, Lisa? All right. So obviously we have folks from all over the country. So if you haven't told us already where you're from, please do put in the chat where you're from. And as I said, C.A.S.E is located in Burtonsville, Maryland, but we of course serve folks across the country, and we're going to tell you more specifically about our NTI training and some of our partners that are integrating NTI into their training system. Next slide. Okay, so the National Adoption Competency Mental Health Training Initiative provides foundational knowledge and skills on assessments, support services, therapeutic interventions, and promotes permanency and improves well-being for children and youth and their foster, adoptive, and guardianship families. This webinar features examples of how state and local child welfare agencies have promoted the integration of NTI within their training array and collaborated with mental health professionals to improve mental health and child welfare professionals to improve child and family stability and well-being. Presenters will share their experiences emphasizing building partnerships and promoting a shared language between child welfare and mental health. So you can see on the screen today's webinar kind of topics that we're going to be covering, and I will not read that to you, so I'm going to assume that you can read that yourself. Today's webinar objectives, we're going to be, our hope obviously is that what you're able to do at the end of this webinar is understand the value of adoption competency and the NTI training to improve adoption competent practice, to apply examples of how the NTI training knowledge and skills can be applied in various work settings, demonstrate the value of collaboration between child welfare and mental health professionals to promote permanency and well-being, and access and assess the benefit of integrating NTI into an organizational training milieu or environment, and also how to access the training. Next slide. So I know we asked you to tell us when you joined kind of where you're joining from, but maybe you could share in the chat a little bit about who you are. Are you a member of the adoption constellation, an adoptee, an adoptive parent, a birth parent? Are you in an administrative role? Are you a supervisor, caseworker, case manager, a therapist, social worker, some other role? If you just want to let us know kind of who you are, that would help us sort of have an understanding of who's joined us today. So we are happy that you're here and happy that you're able to learn a little bit more about integrating NTI into practice. All right, next slide. All right, Lisa, you can take it away.
Okay, thank you. So the Center for Adoption Support and Education was created in 1998 to provide post-adoption counseling and educational services to families in Maryland, Northern Virginia, and Washington, D.C. C.A.S.E is a private nonprofit service agency envisioning that everyone touched by adoption and foster care has the right to access adoption competent services. We've really taken that charge and have been very pleased that the Children's Bureau has given us funding to do the adoption competency training across the country over the past several years. You can learn more about C.A.S.E and our mission and vision and goals and strategic partnerships by visiting adoptionsupport.org. Through our work, we've seen a real need for change in how we address mental health issues and the needs of children. The Children's Bureau helped us to really address the gaps that we've seen. So I I jumped the gun a bit and put the poll up early, but if you haven't already, just take the poll. What do you know about NTI? We can see from our attendees that there are several people who already have heard about the NTI training. We know that there are some who've completed. If you haven't already, do answer the poll. You'll see these numbers ticking up. Really, really love it when people say they don't know anything about NTI. That's a great audience for us. We want you to know all about it. And then for those who've started it and completed, those are great too. And if you heard about it somewhere, we're going to give you more details so that you can make that decision to go ahead and take the training. So I'm going to end the poll and I'll show the results. Yeah, so about 32% heard about it, 22% started it. About half of the people here, close to half, have completed the training. Hooray for you. We're excited about that. And have been added to the National Directory of folks who have completed NTI. So that's great. I think we today will have something to offer everybody. Okay. So the curriculum, the NTI training, consists of two different curriculum, kind of three, but the child welfare curriculum is 20 hours, and that has a supervisor component. So it's just an add-on for the child welfare curriculum. The mental health curriculum is about 30 hours, and it has coaching sessions optional. Child welfare has 8 interactive learning modules that's really focused on casework practice. The mental health has 10 interactive learning modules that are more focused on clinical practice. And there's a lot of differences, but mostly they're super aligned and present mostly the same information, just with a different focus again. The supervisor coaching and activity guide is to help supervisors integrate this learning into day-to-day practice. Both are approved for NASW credits. The child welfare curriculum has 20 for child welfare staff and 25 for supervisors, and the mental health curriculum has been approved for 25 continuing education credits as well. Okay. So really the goal of NTI is to create some systems change. That's what we want to see. There are plenty of trainings that people take all the time, and it's, you get good knowledge and maybe you're able to use that in your practice from time to time. But really what we're striving to do is create system change across the country. We want to create that shared language between mental health professionals and the child welfare professionals so we can better serve children and families. When we're all speaking the same language, we know what we're talking about, right? The American Academy of Pediatrics has identified mental health issues as one of the biggest issues for kids in care. Through the NTI web-based trainings, C.A.S.E supports a common core of mental health and adoption learning to enhance the ability of child welfare and mental health professionals to speak that shared language so that we're all talking about the same thing, so that we can collaborate to better serve adopted children and their families. Right? We need to be speaking the same language, or things get lost, kids get lost, and families split up. NTI gives mental health and child welfare professionals the skills, tools, and knowledge to provide competent mental health services to those families built through adoption, foster care, guardianship, and kinship. We've worked to support this collaboration between child welfare and mental health to improve permanency outcomes and the health and well-being of adoptive families and guardianship families across the country. A comprehensive list of our core competencies and learning objectives can be found on our website, and we'll put that in the chat box for you. And we've got our partner here, Bonnie, is going to talk with you a little bit about how we have made that bridge between child welfare and mental health and the benefits of that. So I think we'll talk a little bit about transfer of learning, Dawn, why that's important.
Yes. All right. So what is transfer of learning? Well, we know that it is a process that is interrelated series of tasks performed by supervisors, trainers, learners, co-workers, administrators, before, during, and after a learning intervention to maximize the transfer of knowledge from the training to practice, and also the transfer of skills and to improve job performance. So, why is this important? So why do we want to do this? Well, here's what we do know about training. Training is fabulous, but training in and of itself really is not enough. And do you want to go to the next slide, Lisa? So here's what we know about folks who take training. Learners lose 70% of what they're taught in the first 24 hours of training. That's a little scary. Less than 10% of trainings get successfully transferred in the real world. And less than 40% of trainees had applied less than 40% of their knowledge and skills from training when they were measured 90 days post-training. And the reality is that learning is more than the acquisition of knowledge. Training is great for that. It does help you acquire new knowledge. But what we want is to help you learn to apply that knowledge in your practice. And that's what transfer of learning activities are really all about. So, it's kind of frustrating to think about. We go to all this effort to train folks, but it makes sense from a brain perspective, right? Because our brain only has so much room for information, and it's always pruning information, right? To make sure that there's room for the most important knowledge. I mean, you don't want what you had for breakfast yesterday to have the same importance as where the fire extinguisher is in your house, right? So that's what our brain does. But that also means that when we take training, we're not gonna keep 100% of everything we learn. So that's where the transfer of learning comes in. And so obviously what this is about is connecting the dots. We know that training can be costly, even if it's free. And guys, NTI is free. It is free training. But we know that it's really not free because it does require a significant investment of staff time. When we're talking about 20 to 30 hours of training, that's a huge chunk of time when people already have full-time jobs and caseloads and all of those things. So we do know that it's a significant investment of time. So we want you to sort of be thinking about what are the goals for training beyond just the acquisition of knowledge. We want improved practice skills that serve children and families more effectively. We want staff to feel equipped and perform well at their jobs. And we want learning interventions that are resource heavy. And one of the things I want to say about NTI, one of the things we learned from our pilot was that, in particular, child welfare workers who took this training came away from it with a greater sense of self-confidence and self-efficacy, that they really felt like they had skills that they could apply with families, and it made them feel better about their jobs. And if you think about what that means from a staff retention standpoint, I think it's safe to say that's only going to improve your staff retention. All right, next. All right. we're at the most important part of today's training, and that is to hear from one of our really wonderful champions. For those of you who don't know, when we piloted NTI training, we piloted it in 8 states and with the Cherokee Nation. And one of the states we piloted in was Oklahoma. And of course, that's also where the headquarters for the Cherokee Nation is. And Bonnie was a huge part of our initial work to really pilot NTI, but has been a champion since even before then for this focus on adoption competency and what does it mean for practice. So I'm going to turn it over to Bonnie, and I'm going to let her tell you a little bit more about herself and then about NTI integration in Oklahoma. So Bonnie, welcome.
Thank you so much, Dawn and Lisa. And man, I love these opportunities to be able to share my heart, actually my passion for this work, but also share some of the things that we've been able to do. I see some of my Oklahoma people on here, so shout out to Oklahoma, hello. I do want to give a little more background as well, that I have a history of working in mental health as a provider. I worked in a adoption specialized counseling center for about 5 years before I moved over to research at the University of Oklahoma. And my research focuses on adoption and adoption, post-adoption support, pre-adoption preparation. I'll tell you more about that in a little bit. But one key thing that I want to share about why this topic of adoption competent mental health and how to really integrate it into training within child welfare as well as mental health it really comes from my own research that I've been doing with adoptive families and children and the work that I did in practice. This is still what I'm hearing in active research interviews with adoptive families. This is still an issue of wanting to know that there are professionals out there who really understand what their experience is, and then have some really good skills and knowledge of how to help them through. And that's still what we hear of one of the biggest needs in post-adoption is we need more people who really get it, who really understand. You can go to the next slide. So Dawn already shared that Oklahoma was able to be a part of the pilot of NTI. Feels like a long time ago now, several years ago. And I will say that in Oklahoma, I feel like we had a really good understanding and awareness of the need for adoption competency in our professionals who service families. But then I also have noticed there's quite a renewed focus and awareness of it just within the last year or so. And I think some of that, there's a lot of different possibilities of why that might be. I do think that some of it has to do with the mental health crisis across our nation right now. Children and families, as we went through the pandemic and are trying to come through that and heal from some of the shared trauma that we all experienced and still experience to some degree. I think that that is just heightened and something that we notice more and more often within our families who have adopted. And so there's really I'm excited because I think there's more of an awareness and a desire to understand what is this thing of adoption competency? What does it mean? And then what do I need to do with it? You saw I've got 2 different roles, one with the University of Oklahoma, but really my main one, what I'm using most of the hours of the week is the statewide coordinator of adoption preservation services. And there's 2 main pieces to what I'm doing and how I'm utilizing NTI training in that role. One is clearly within the Oklahoma Department of Human Services with child welfare staff, and I'll get more in depth of how I'm utilizing NTI and all that I do there, but then also mental health. So there's, just as the training provides those 2 separate types of training, that's really where a dual focus of mine in this position as well. Next slide. Okay, so I want to talk a little bit about the relevance of NTI within the different aspects of my work and where I'm focused. So within the child welfare workforce, it really hits multiple different levels and different focuses within the department. So pre-adoption preparation, I spend a lot of time talking about the different aspects and the different competency areas that are focused on within NTI in helping prepare our families, and that's foster families, not even families who necessarily are 100% adoption yet, but foster and pre-adoptive, talking about what do we need to help them be prepared for, what can we help them set expectations and understand what might be ahead. And the NTI training really helps us be able to put the correct lenses on, the correct glasses, to be able to see what are some of the things that we might need to prepare families and prepare kids before they actually get to that place of adoption and adoption finalization. And that's also talking about adoption transition, that in Oklahoma, it's the 6-month time frame, typically, an average of that time frame before finalization, when the child is either placed in the home or the goal turns to adoption and working towards finalization. So a lot of our training and support of the workers who are going out on those regular visits to touch base with families and kids to see how they're doing. And whenever challenges come up before finalization, all of us know the impact of adoption disruptions on the family and the child especially. And so there's a lot of times where I'm able to pull in some of the NTI material when we're talking about transition and what some of those challenges might look like. And then of course, post-adoption support. Our post-adoption department, I'm loving it right now. We're digging in. The staff itself, all of the staff are coming together to really focus in and understand how can we bolster our support for families across the state. Next slide. Then mental health. This is an ongoing conversation with our mental health community, and I'm really excited having more opportunities day by day right now to be able to share what NTI is, what adoption competent mental health is, and how it's actually very easily accessed. That you have this free training, like Dawn said, that provides CEUs. And I think the key aspect of relevance here is understanding that adoption, the NTI training is not a specific training on an intervention or a model, which is so much of what training is when you're a mental health provider. But this is more of a broad framework and a broad understanding of major critical aspects that are necessary in understanding the unique experiences of kids and families. And then, of course, adoptive families. I think one of the biggest keys that I've utilized NTI training and content is helping adoptive families recognize, again, those glasses of what is actually happening here. And when I'm reaching out to connect with and work with a provider, a mental health provider, how can I know? What questions can I have? What conversation can I have with the providers to help them understand how critical and important this competency understanding is, and really equipping parents to understand how can I advocate for that as a family and as a parent. Next slide. And then formal and informal services. So this goes beyond the workforce and the mental health community into support groups and networks of organized parents who are connecting together, foster and adoptive. We have an organization that's statewide here, and really helping them have the understanding of what adoption competency is, understand that NTI is available for free and it's out there, and really connecting providers together, helping people have that shared language across the whole state and the adoption and foster care community, and being able to just provide for them the avenues to be able to strengthen each other. Next slide. Okay, so now I'm going to get a little bit more in depth on the actual application. So I mentioned the workforce. There's two different aspects. This first one, this is across all of the Department of Human Services. We have been able, since we did the pilot, we've been able to not only access NTI training through CapLearn or through the C.A.S.E website, but also we've taken the training and have put it within our own LMS system. And that's for anyone who is doing training within any staff, any employee works through that initial training and then levels training. So where it just goes a little bit more in depth in each level that you're trained in. And NTI is one of our levels training. So we have the new child welfare that kind of gives the ins and outs and the logistics of being a child welfare worker. But then NTI is one of those very next trainings that our employees across DHS take, so that then they're able to have this full concept and full understanding of all the different aspects. The Youth Transitions Unit, I'm really super proud of how this unit has taken NTI and embedded it even deeper into their daily work. NTI, without it even being, before it was functioning as a levels training, they had already required it for every new staff member. So it's a big part of their onboarding process. And again, just like what Don and Lisa were talking about earlier, it's not just a, here's the link, go take the training, but here's the link, take the training and let's process it together. Let's talk about it. Monthly staff meetings. I have been invited several times on a regular basis to come and join their monthly staff meetings and focus in on one aspect or one strategy, something to go in depth and really highlight something from the NTI training that we can really dig into and work with cases and talk about how could you actually use this in the cases that you're doing every day. How can you, let's work through it together. Let's process when would be a good time. What tools do you need? What resources do you need? And how can we get those for you? And then, like I mentioned just a second ago, staffing challenging cases. When we have the emotional and behavioral challenges, when we have parents that are dealing with a lot of other aspects that cause an increase of stress, all the things that we know in research increase that risk of breakdown. I'm able to, many times I've been able to join the family and all of the DHS staff. And the cool thing is the mental health providers. We've been able to have conferences where we can actually all come together, talk about the challenges that are happening and brainstorm. And I'll pull in some of the competencies, the knowledge, the awareness of the age of the child, loss and grief that might be occurring at this time that maybe the child doesn't even recognize is an actual outpouring of some unresolved grief. We can talk about attachment, all those different things that NTI covers. We can pull into these staffing meetings and be able to really help not only the child welfare workforce, but we're talking to parents and the mental health providers who are actively working with the family and child at that time and help brainstorm and think about how does this apply and what are some of the strategies and resources NTI provides that we can utilize right now. Next slide. Post-adoption. That's my other favorite group within the department. And we also have been able to really do some monthly regular in-depth staff meetings that again, there's so much information in the training and there's so many incredible free resources that are provided within the training that I think that's been one of the biggest things that's helped the workforce as well as myself, is being able to identify, okay, this month, let's take loss and grief, just that. Let's take some of the resources that NTI provides, make sure everybody has it in their hands and they're looking at it. And let's highlight it. Let's go way in depth on this concept so that then we're able to have a better application and understanding of how does this apply to every single situation that I'm working on my caseload. And then also phone calls with adoptive parents. This is a cool part. When we're talking about, so identity formation, that's one of those big concept areas that NTI does an excellent job of helping us understand how does that integrate and weave with adoption. Grief and loss, another huge one. So those two really are, when our post-adopt staff get some of those crisis phone calls from families saying, hey, we're struggling and we don't have good resources, we don't have a competent mental health provider that's helping us understand how to navigate through this. A lot of times, those are the two concept areas that I think apply to some of those situations. And some of that is adolescence, puberty, identity formation is that time frame of whenever adoption really plays a role, as well as trauma experience, so many complex layers to it. So helping our post-adopt staff have the lenses, just like I'm going to keep saying that over and over again, because I think that's really what the key is of NTI and adoption competency, is having the right glasses to see all the things. So being able to provide those glasses for our staff, but then provide wording. How can I sit on this phone call when I don't have this lengthy history with this family? So it's a crisis. This parent is upset. There's emotion involved. How can I, what language can I use? And how can I incorporate some of this information about identity formation and adoption and loss and grief in this brief phone call to help the parent take a breath and put on those glasses themselves and start to see the situation, maybe with a little bit of different light, or just giving hope that this is not something that they're experiencing alone, but this is a part of the process. And this is a part of what our adopted kids process and deal with as they continue to grow and develop. So that's another layer, is we're talking general, and then we're talking specific cases, but then we're talking about specific conversations where they're actually able to take some of this language from NTI and utilize it in conversations to encourage our parents. Next slide. And then mental health. So the other big half of what I consider to be the professional community that I am drawn to, and also try to reach out to and support in any way that I can. Again, that lens, I think that's the biggest message, is a lot of time mental health providers who are very experienced and have done wonderful work, but it might be that there's just a piece missing, or a part that they didn't know that adoption really plays a big role in. I think most of the time with mental health providers, the conversation always gets to that concept of child development and identity formation, because that's when a lot of our challenges happen, is whenever our kids are adolescents. It's a tumultuous time anyway. So add on trauma, add on loss and grief, add on attachment challenges, and adoption, pulling all the pieces together to try to understand, who am I? Big, big, big piece. So helping provide all those pieces to the puzzle for mental health providers to see what is happening in these families that I am in, that I get the privilege of working with. But also building a network of providers. That's really our next thing that we're working on in Oklahoma, is pulling providers together so they can talk through, similar to what I was just saying within the child welfare units and different departments where we can do that monthly staffing. We're working on creating a network like that for our mental health providers across the whole state, because we all know that states have rural areas and urban areas, and most of the time our service providers are connected and have more resources in urban areas than rural. We have a lot of rural providers in Oklahoma. So utilizing technology, Zoom, Teams, whatever platform you want to use to virtually bring providers together to do that same thing. Talk about, okay, let's do a highlight about this goodbye letter. How can we actually use that with some of our cases? What cases might we need to apply something like that to? Same lens together, connection, support, and then also that same language where we can continue to have the same concepts and the same way that we're describing and seeing things, so we can communicate effectively. One thing that's been really cool is I've been able to have the privilege of doing monthly coaching sessions. It's something we did in the child welfare pilot in Oklahoma. I was able to meet with one unit it was much faster pace. So it was about every 2 weeks, but it was every time that they finished a module, I would meet with them in person and highlight resources, highlight strategies, and do a little bit of case consultation. But now we've expanded it to every month because I think it takes a long time to digest a lot of the information in each module in NTI. So if you take a month to take a module, and then you set up a time, especially with someone who can come out from outside of your agency and sit down and process with everyone, how does this apply to you? What cases does this make you think about? What resources, again, I'm going to talk in a minute at the end of my time about some of the specific strategies that NTI covers. And there are a few that need resources. You need some things that you might not already automatically have at your disposal in your agency. How do you get them? Where can you find books to help you learn how to do some of these things? So talking through resource management and being able to access. So that's a lot of what the monthly coaching sessions look like. And it's fun. That's one of my favorite things, is when I get to meet with mental health providers and just dig in. And then ongoing consultation. So I mentioned in those staffing, whenever one of the child welfare units is saying, hey, we're in a crisis level here, can you come join us and talk? It's been so cool whenever a mental health provider is able to join that, because that staffing, because then we can build a connection between myself and that therapist and have ongoing consultation, even if it's just over email of like, hey, here's, I need some more resources of how to process loss and grief. My 12-year-old is struggling to figure out, even identify what they're feeling. What are some suggestions? What have you tried? What worked? What didn't work? Things like that. So ongoing consultation with various mental health providers across the state. Next slide. Okay, so here are some of the specific tools that I have really focused in on in some of those monthly meetings or case consultation sessions, when I'm able to really hone in on, here's a strategy that really works. The first one is the adoption competent biopsychosocial assessment. I think as a parent, whenever I've got an adolescent, and we've all been through the pandemic, and we're all, I'm just being vulnerable and honest right now that I've been looking through some of the different mental health providers that we have around me in my community to look for my own child. When you're doing that, it's interesting because a lot of them will put some type of assessment, the questions that they're doing online. And it's a really stark difference when you start paying attention to, here's what an intake typically looks like, and here's what an adoption competent assessment looks like. You can see the difference of how far back are the questions going? What are they understanding about the adoptive story, the experience of the child losing their biological family members? How many caregivers, attachment figures have they lost through that time frame? That's the adoption competent lens of understanding the impact and the importance of losing attachment figures. And then also, how many potential adoption situations did that child lose? How many disruptions? Were there any dissolutions? So after finalization, those things are really critical in understanding the big picture of what might this child be experiencing now. And so really going in depth and understanding, a lot of times when I'm working with mental health providers, I'll ask them, pull your intake, your assessment, your biopsychosocial that you do now, put it side by side and just go through it and think about, when you see some of these questions that you are learning are connected to this adoption competency within the training, where do you see that in this assessment that you've been using? And how do you see that it might be different? And what are you missing? And what's important? So that adoption competent biopsychosocial assessment is an actual list of questions. It's an assessment that is provided for free within the mental health version of NTI. And so it is as easy as getting to the resources, downloading that, and looking at it and utilizing it. Another one of my absolute hands down favorite activities that I think I try to incorporate in every situation that I'm talking, if I start noticing, which I think is almost always, there's going to be a layer of loss when we're working with a child who's been adopted. Loss and grief is big, it's huge. In fact, in our pilot in Oklahoma for both the child welfare and mental health providers, that competency area was actually what most of our employees and professionals scored the lowest in before the training, and then scored really well after the training, of understanding the impact of how many layered losses of relationships, but then also ambiguous loss, where it's not, that's so complex, it's so much more complex. Loss is hard anyway, but then losses that aren't the death of someone, the lingering hope that that person is still out there and someday I'm going to be reunited with them, and not fully understanding whenever some of those relationships are truly different. And that's the other thing, is it doesn't, with the understanding and the understanding how children can benefit with having connections still with biological family. It's such a helpful thing as they continue to grow and develop and understand who am I, to have that access. But it's also hard understanding this role and identity relationship between us is different. And so there is grieving, even if I still have this person in my life. So that is complex and it's hard. So good goodbye letter is utilized. I utilize it all the time from two different perspectives. One is where helping a child or even the parent be able to write a goodbye letter to something that they may not have previously identified as a loss because it was so ambiguous or it was not recognized. And so recognizing it, writing a letter of saying goodbye to it, and then being able to process what emotions came up from that. What did I, most of the time, what I hear from people when they write that goodbye letter is, wow, I didn't realize how much that impacted me. I didn't realize all the emotions that were tied to that. And now they're here. And so then being able to process, what does grieving look like for you with this? How can we help you? What are maybe a memory box, all different types of strategies to help kids be able to deal with some of that grieving. Another way we use good goodbye letters, and this is what NTI really incorporates in the discussion of this resource and tool, is helping when a child has those layered losses. A lot of times we don't necessarily do all that we can do to fill in the gaps, to understand why was this person lost, especially if the child's very small and young. And a good goodbye letter is a way that we can have, if a child is moving from foster home to another foster home, or even foster home to adoptive home, or foster home to reunification, if we can encourage and support that foster family that's saying goodbye to the child, to help them write a letter that is actually going to be given to the child. So it needs lots of support and lots of help to give some good guidelines on writing that. But that can be so critical and essential and have a really profound impact on the child later in life, whenever they're thinking back through their own story. Because as that child's brain is growing and maturing, talk about lenses, they're putting on different, more mature lenses to look back at their whole story from different view. And so when there's something written down, these are the strengths that I see in you. These are the great experiences that we had together. I got to celebrate your 5th birthday by taking you to the zoo, by even talking about, and this is what needs the most support, I think, from the professionals, and a good, competent professional, is if there were some challenges, how can we acknowledge those with words that can say, even though these things happened, I still see so much good in you. right? That can be so healing and so helpful to a child as they continue to grow, because so many times our kids look back at all those layered losses and they blame themselves and they see themselves as the problem. So Good Goodbye letters is flexible and incredible, and I love it. Last one that I wanted to touch base on is one of the like stalwart, huge tools and strategies that we have in adoption competent mental health, life books, digital stories. And this is the one, it is where we are helping kids be able to tell their own story, where they can start filling in some of the gaps and they can add to it and change it as they get older. Digital stories is where they're doing the same thing, but they're utilizing some type of online digital process. It can be creating videos, it can be creating, I can't think of the other word I was thinking. Oh, social media, being able to pull in all these different things based on their age. And that's the one where when I'm working with mental health providers, that's where I really need to sit down and talk about, okay, what do you understand of how to use some of these tools and what do we need to learn? And there are books out there that I bring and I'm like, here's a book for 20 bucks that you can actually buy and read that give you step-by-step instructions on how to be able to create a life book or a digital story with this different type of platform. So very basic resources that can be, it sounds like a great idea, but it's really hard if you don't know how to do it. So those are some of those specific tools that I've found to be really, really helpful, and some of the most important things that we've talked about in all those different times I'm able to meet with professionals. All right. Thank you guys so much. I think this is where, Dawn, were you going to ask me?
Yeah.
Go ahead.
Thank you so much, Bonnie. And as you were talking about using, in particular, these particular resources, the Good Goodbye letter and life books, and it sounds simple, the biopsychosocial assessment, but it's transformative in the sense when you are using those kinds of tools, it can really transform practice. And I guess I would just want you to take a few minutes to sort of think about, because it's been a few years since you piloted and you've had a number of folks kind of go through this training, what aha moments and or lessons learned would you say, would sort of represent what's going on in Oklahoma?
Yeah, I think there are two that have come to my mind. The first one is that it is not a one-time training. This is not material or content where you just complete the NTI training, you're putting your name on the national directory and you're done. But it's something where it is considered, to me, it's like an encyclopedia. It's a reference material that I have tabbed on my toolbar on my website, and I constantly am pulling it up, constantly am finding, okay, I even have some of the module numbers, lesson numbers, and slide numbers memorized, because I know that's where I can click on the resource and get this exact handout. So, I mean, it's that much of a reference guide to me. And I know I've heard the same thing from a lot of our leadership and frontline workers, is this is something where I've got to have access to it on an ongoing basis. And a lot of our supervisors and mental health directors have downloaded all the resources from and put it in a catalog that is accessible by the entire department or agency. And that's something that they're going to on a regular basis. So I think that's one of the biggest lessons, is not to approach this as a one-time deal, but it's here's the training to give you the overview, and then you're going to revisit it forever. And then the other thing is really the importance of having that case consultation, that it is not, again, it's an incredible training. I mean, you touched on this with the transfer of learning stats. It's an incredible training. You're going to learn something no matter what you're doing. But whenever you're able to spend the time to take your time with each module and then process what cases on my caseload does this really connect with, and then talk through. So not even just making the connection, but doing the application. How can I use this? I'm going to go try it. And then next month, I'm going to come back and report to everyone here how it worked and how it didn't work and what I'm confused about. So working through it, kind of wrestling with it a little bit and practicing are some of the most important aspects of utilizing NTI well.
Thank you, Bonnie. Wonderful, wonderful input, and I think a wonderful experience, certainly in Oklahoma. And you know, we love having you as a champion. Obviously, I think it's clear the passion that you have for this work, and how NTI sort of came along at a time when you were really ready to do this kind of work at this level in Oklahoma. So we're really excited about that. Lisa, do you want to change the slides? And I think we've got Bonnie's contact information.
Oh, sure. Yeah. I want to say thank you too, Bonnie. Such passion, such a champion for NTI. I think it's, you just do such a great job in communicating what's beneficial about it and why it's so important. Why adoption competency is so important. And I think that's a great lesson for all of us. I've been in the field for a long time and have thought that we needed more adoption competent professionals forever, and we still do. And so this I think goes a long way for that.
Thank you guys for letting me join you. I love it.
Sure. And I also want to let folks know, I did put a little bit earlier in the chat. So first of all, we did provide you with a copy of the slides. So if you want those, you can scroll up in the chat and find TOL is the name of the document. But I also wanted to mention too, I put earlier in the chat how to access more information about NTI at our website. And we also have a supervisor coaching and activity guide, which can help supervisors who want to kind of do this consultation work with their staff, help them utilize actual skills and tools and resources from the curriculum in their supervision. So I just wanted to point that out as a resource that's available for people as well.
And Dawn, I'd like to put a plug in for, we are also able to provide coaching support. We've done that in several places around the country. Edna and I can lead coaching and supervision groups to give supervisors really some more of this transfer of learning support and how to keep NTI in the forefront. Bonnie, I love that you've got a tab on your computer and that there are downloaded resources. It's all free, folks, and for your use and for your learning. So we're happy to support however we can.
Yeah. Thank you again, Bonnie. We appreciate your work with NTI. So I think, Lisa, it's your turn, isn't it?
Oh, I could take this.
Is it my turn?
Okay. So we have had the great good fortune of receiving funding for outreach, implementation, and an integration into additional states, tribes, and territories through the next, well, I don't know, Don, how long do we have that funding for? Another year?
Next year. Yeah.
Next year. So it's a free training. This funding extends well beyond our initial 5-year grant. And we're just so pleased that we're able to do this. We're looking to integrate NTI in all the states that have not yet done so. So if you are in a state who you don't know if you've got NTI in your state, or you're pretty sure it's not there, contact adoptionsupport.org. Contact Edna or I'll put our contact information up on the screen in a moment. We've got lots and lots of resources for you. If you go to our website, you can find demos, you could find our learning objectives. It's just our website, before you even get into the training, is just so rich with resources. So take a peek at that. If you are interested in accessing NTI as an individual, super simple. You go to our website, you click on Access on C.A.S.E LMS, and or you could access on CapLearn. You could do either one. The C.A.S.E LMS at this time provides CEUs for free, so that's sort of an incentive to use our learning management system. You click on the Access C.A.S.E LMS, you complete an enrollment form, and then you're good to go. Super simple. If you work in an organization and you're thinking, wow, Bonnie did a great job of integrating that into the entire DHS in the state of Oklahoma, we should do that too. Just give us a holler. Edna and I can help you work through that process. Again, it's a very simple process. 1 or 2 more steps in addition to just accessing as an individual.
Hey, Lisa, can I add one more comment about the NASW approved CEUs?
You bet.
So if folks access the NTI training on our learning management system, the C.A.S.E learning management system, they will have access, if they complete all of the training and the post-test, they will have access to the CEU, either 20, 25 hours, I think that's what the mental health provides. But I just wanted to make a note that NTI is approved for NASW approved CEUs through us. For other host sites, they would have to get their own approval through whatever licensing board they want to work through, whether it's statewide or national, in order to have approved CEUs on their own learning management system. It's just want to make sure people.
Thanks, Don. Yeah, that's a good point. NTI has a directory of NTI trained professionals. This has been really useful for a lot of providers across the country. I have a small private practice in upstate New York, and every now and then I'll get somebody who says, you know, I'm looking for a therapist who is adoption competent in the city, and do you know anybody? And I go to our national directory and I find somebody who's in that area. Again, we've got professionals, therapists, mental health counselors all across the country who have completed NTI and have uploaded their certificate to our website, and then get listed on our website as an NTI trained professional. And what a great resource for families who are looking for somebody to work with their family, but they want to know, they don't want to go through the trouble of educating a brand new therapist or somebody who doesn't have any idea of adoption competency, who doesn't understand the key and core issues of adoption, and can oftentimes do more harm than good. But a great resource to be able to say, hey, I know where to find somebody for you. And if you've already completed but haven't done that step, please do, because we want this to be a robust directory.
And you can do that by going right to that same page, and there's a button that says join the directory. You just click on it and provide your information.
So this is the part where we say, does anybody have questions? We're happy to answer questions. You can put them in the chat. You can unmute yourself and ask the questions. It's our job and our great pleasure to help each and every one of you integrate NTI into your day-to-day practice, and however we can do to help that happen, we're really happy to do.
Yeah.
Any questions? Edna, are you seeing anything? Our chat monitor? No? Okay. All right, I'm going to go to our contact info. As I said, Edna and I are happy to assist you if you're an individual wanting to get the training and are not quite sure what the next step is. If you are with an organization and want to bring NTI into your organization, we're happy to assist you in that as well. And I think we're good. What do you think, ladies?
So, yeah, Lisa, I just put in the chat a link to the survey. And so if you open up the chat, it's the last thing in the chat. If you would please click on that link and complete a short survey about today's webinar, and then you'll have the ability to, I don't know if the word's upload, download, print out a certificate for today's webinar. We're not able to provide CEUs specifically for today, but we do have a certificate of attendance for you that you can use for your own purposes. So please do, you won't be able to get a certificate unless you do that survey. So I would encourage all of you to please click on that link, go ahead and just have it, pulled up on your computer. So when we close out the webinar, you have that survey link.
Yep. And then when we close the webinar, when we close this webinar, yeah.
It should also pop up on the screen as well. But just in case, if you want to make sure you have it, if you click on it now in the chat box, you'll have it there too.
Great. So again, want to thank Bonnie. Oh my gosh, Bonnie, just your passion, your excitement, it just lights me up. It makes me so excited about what we're doing and the difference that you're making in this great state of Oklahoma. So thank you so much. And when Edna and I are out there, we're gonna hook up with you for dinner, okay?
And I'll put a plug in if any of you are going to be attending the Child Welfare League of America conference coming up at the end of this month. Bonnie and I are presenting on Wednesday at 3 o'clock on adoption competency, sort of the need for adoption competency and sharing more about NTI and tax. If you're there, we would love for you to join us and come and talk to us. And we just want to keep spreading the good news about our NTI training. So thank you all for joining us today.
Thanks,
Really
everyone.
glad that you were with us.
Do the survey.
you
Thank
all.
you so much. Bye-bye.
Bye.